Hey, good morning, everyone. I just want to thank you first for joining today's webinar. Today's topic is going to be recurrent ankle sprains. Today, I have a treatment session videoed of a young lady who sustained a grade 2 ankle sprain. She also suffers from recurrent ankle sprains. So, throughout the webinar, we're going to go through the treatment session and highlight some of the important techniques or and information that we use throughout the session. And hopefully you can take some things home with you with that information. So before we get started, I just want to cover the basics about an ankle sprain. So we know that ankle sprains occur when the foot is plantar flex and inverted. So with this injury, we find that the individual's everter muscles are weak. We also find that their anterior talofibular ligament has partial tears if it's a grade 2, which our patient has. It's just overstretched, which is a grade 1, or it's completely torn, which would be a grade 3. We also notice that sometimes there is involvement of the calcaneofibular ligament. In this scenario, that ligament is actually loose because of the recurrent ankle sprains. So today's treatment session, our goals are to normalize gait, increase her range of motion, stretch the muscles that are tight, and to increase her stabilization in her ankle. So I hope you guys find this interesting and helpful, and let's get to it.
Hi.
Hi,
My name is Janelle. I'm your student physical therapist assistant today. Can I get your first and last name?
Samantha Mulvihill,
All right, great. And what's your date of birth?
June 10th, 1991.
Excellent. Do you prefer Samantha or Sam?
Sam, please.
When
All right,
introducing
great.
yourself to your
Well, Sam,
patient,
we're
you want to make sure that you state your name, your position, and you ask for consent to treat. You also want to go over an overview of what the patient should expect during today's treatment or the day's treatment. You want to highlight key things that you will be doing with the patient just so that they are aware and they can, get ready for what is to come.
excellent. So what I'd like to do to start is to get your heart rate. And then while I was doing that, I also checked your breath rate. So both were great. Your heart rate is about 75 per minute, and your breath rate is 15 breaths per minute, which is really good. All right, so I'd also like to see that ankle. How's it feeling?
Pretty good right now. It hurts a little bit when I walk around, but
Okay.
sitting and everything's great.
Excellent. So when you are walking, if you had to assess that pain on a scale of 1 to 10, 1 being almost nothing at all, 10 being the worst pain you've ever felt in your life, where would you put it?
Probably like a 3 or a 4.
A 3 or a 4? All right. That's good information. So good feedback to hear. I'm glad it's not hurting while you're moving. You're wearing your brace. Now, where are you feeling the pain when you walk?
So usually I'm feeling it like right here.
Okay.
So that's where it hurts.
Okay. Gotcha. So I'm going to apply a little bit of pressure. Does that make it hurt?
No, not at all.
All right, excellent. And then I'm going to keep feeling around your ankle. So it feels like the swelling has gone down, which is awesome. It's looking really good, which means you are progressing to that next stage and we're ready to get some strength in there. So what I'd like to do, go ahead and relax your foot. Can you move your foot up and down for me? Great. And now kind of turn it in and out, so the inside and the outside. Good. Excellent. And now can you do like a circle motion with your ankle? Excellent. Now the other side. Good. Okay. Go ahead and relax. So there is a little bit of restriction in there, but it's looking like you're getting a lot of your movement back. So what I'm going to do is I'm going to measure those different areas and get some good numbers written down, okay?
Sounds great.
So to do that, I'm probably going to have to put some marks on your ankle. It will wash right off, but do I have your permission to do that?
Of course, whatever you need to do.
Excellent.
Our patient's subtalar eversion measured at 3 degrees. We have 5 degrees as normal. The gastroc length measured at 8 degrees today. 15 to 20 degrees is normal. And our patient's dorsiflexion measured today at 8 degrees And again, 15 to 20 degrees is normal.
All right, well, during our evaluation, we did realize that there was some restriction in this movement here where your foot comes up, which we call dorsiflexion. And so in order to help work on that, we're gonna do a cross fiber friction massage. And what that does is anytime there's inflammation or swelling, it creates scar tissue. And so that makes the fibers that wanna lay down just in straight lines, they become all hashed and going in different directions. So by applying that cross fiber massage, it allows those fibers to lay down smoothly in straight lines. Okay, so to get started, do you mind if I come on the bed with you?
Go right ahead.
All right, excellent. And what I'm gonna do is I'm gonna have you flex your foot just to make sure I'm on the right spot. Great, go ahead and relax. And then we're just gonna apply our massage.
So as you can see, Janelle is applying a cross friction massage. And when you do this in clinic, you want to apply this massage for about 2 to 5 minutes. And you can apply as little or as much pressure as needed to really get to the ligament and really break up that scar tissue.
Okay, great. And now to help, now that we've got those fibers laying down, what we're gonna do is some joint mobility work. And so this will help open up that joint space and get it gliding more completely. So I'm gonna apply pressure going down here at the bottom of your leg, grabbing onto the bottom of your heel. I'm going to push down as I pull your foot up into that motion that we're trying to get, okay? So it looks like this. All right, so based on that assessment that we did notice that these muscles back
During
here
the treatment
are a little
session,
bit tight.
you want to
So we wanna
incorporate
work to
as much
stretch them
hands-on
out.
therapeutic
And so I'm gonna
exercise as
assist you
possible.
with that stretch
In this
coming under
example,
here.
Janelle
And
is
so I'm gonna take
providing
you
a
as far as we
PNF
can.
hold relax stretch.
That's about this far.
And this
That's
is
about as
really
far as you can
good
go? Okay, great. So what I want
because
you to do
you,
is I
as
want you to
the
press down
PTA,
into
are
my forearm
providing
right
the
here,
stretch,
okay?
but you're also
Go ahead and
allowing the
press down as
patient
hard as you
to
can.
be actively involved
That's good. Now
and
count to 10.
engage their muscles
1, 2,
so
Keep
that
pushing.
you and the patient are
All
All right, a
working
little bit harder.
together.
You got it.
6, 7.
Keep going. You got it. Press,
8,
press, press.
9, 10.
Okay, go ahead and relax.
So the idea of the PNF hold relax
Good.
technique
We're gonna
is
hold
to
here and
increase the
stretch.
patient's
So I
range
want
of
you to make sure that
motion.
you're breathing
So
for me,
here,
just long, slow
after
breaths.
Sam has held the contraction for 10
Great.
seconds,
And now we're gonna do it again.
she's going
Okay,
to
so
relax,
press
and
down
Janelle
into
is
my
going to bring
forearm.
her into
Press,
that
press,
new
press.
range
Go ahead and count.
and stretch that for
Press.
a length amount of time.
5,
Harder. You got it. Keep going.
6, 7, 8, 9.
Good. A little bit more.
10.
Excellent. Now try to pull up a little bit more. Really good. All right, we're gonna hold into this third time. I want you to
After providing the stretch for your patient, you want to show them how they can replicate
20.
what you have done at home to
Great.
keep
Go ahead and relax.
their range of motion and to
And now I
keep
want you
stretching
to hold that
and
stretch again for
you know,
another
just
30
to
seconds.
progress them along with
Should I
treatment.
relax more?
So here Janelle
In
is
between
instructing
for the last
Sam
about 10
in how
seconds.
to stretch
Wanna make
with
sure
a
you're
towel
right.
Absolutely. No,
at
it's a
home.
great question.
10, 20, 30.
Good. Relax.
5, 10.
Good. Now go ahead and pull. Last one.
10, 20, 30.
Great. Go ahead and release. That was excellent. And so that's something that you can do at home. Really, you can't overstretch. So
Okay.
I would recommend. All right. So what we're going to do now is test the strength of the muscle that helps lift your foot up and in. It's called the tibialis anterior. So we're going to start with your foot kind of pointed and then pulled out to the side this way. Okay. And then try to not let your knee do the motion. You're going to bring your foot up and in one movement. Okay. So this is what I would consider your full range. It looks really good. And so now I want to see when you go on your own, if you can get that same amount of movement. So go ahead, up and in. Really good. And that does look like the full range, so that's awesome. Go ahead and relax your foot. So that means you're at least a 3 out of 5. Okay, so we want to see if we can get you to a 5. So go ahead, when you come up this time, I'm going to give you a full amount of resistance to see if I can push your foot back. You try to stay in the same spot. So go ahead and lift your foot up and in. Great. I'm going to give you maximum amount. That's okay. So now we're gonna do it again and see with a little bit less resistance. That would make you a 4. So come up and in, good, little bit less, that's all right. So this time I'm just gonna give you a minimal amount of resistance. You pull your foot up and in, good, and then I'm gonna resist, you got it, come on, hold it up, great. Excellent, go ahead and relax. So that makes you about a 3+. So still room for improvement, but you are getting stronger, which is great. So we are going to work on an exercise right from here to strengthen that exact motion. So I want you to move your foot up and in just like before and then back down, but I want you to move it against the pressure of my hand. So when you're coming up, I'm going to be trying to stop you, and then when you go back down, I want you to go as slowly as possible, okay? So come on up, good, work through my hand, you've got it, great, all the way to the top. Excellent. Now don't let me push you back down fast. Try to go slow. Great.
So what Janelle is doing here, this exercise can be used as a strengthening exercise. You are allowing the patient to go through the full range, but also adding resistance.
All right, so now we're going to test the strength of the muscles that lift your foot out, which we call eversion. So these are your peroneals, and we're going to test to see how strong they are. So the movement I want is for you to make sure you're relaxing through your toes, and then you're going to lift your foot out like this, okay? So go ahead and do that. Excellent. And it does seem like your range of motion matched your passive, which is great. So go ahead and relax your foot. We're going to do that again, and we're going to test the strength. I'm going to give you a maximum amount of resistance, okay? So come up. Good. Maximum resistance. That's all right. We're going to do it again. Excellent. A little bit less. That's okay. And now this time I'm just going to give a moderate amount or a light amount of resistance, okay? So lift your foot up just a little bit. All right, no problem. I do want to see that range of motion again. Make sure we're relaxing through our toes. Good, hold it for a second. Excellent. So I would give you a solid 3, but there is room for improvement. And so we're going to work on that very similar to how we did before, okay? So I'm going to resist you. You move slowly through that range of motion, okay? Coming all the way up to the top. Good. All the way back down, nice and slow. Back all the way to the top. You got it, you got it, you got it.
So as you can see here, Janelle is again applying the eccentric and concentric force as the patient is moving through the range, and this is for strengthening. So this part of the webinar includes exercises. These are some exercises that we would do with a patient in clinic. So this exercise, rotating towards the outside or the lateral side of the foot, is challenging the everters and the lateral muscles outside of the ankle.
And then we're going to go through and do it again.
And then the next exercise you will see after this clip, I'm just working on, again, balance and trying to normalize her gait pattern.
10. Tandem walking, but first we're going to do a tandem stance. And tandem just means one foot directly in front of the other. So step your right foot in front of your left. Yep, heel to toe, and then just see if we can find some balance here. That's okay. Nope, that's good. You can use the support of the parallel bars. That's fine. All right, now let's see if you can move your hand. Great, and I'm going to come in front of you now. Can you close your eyes? That's really good. Okay, so it just took your body a second to adjust. Go ahead and open your eyes. That's okay. So now what we're going to do, you just watch and I'm going to demonstrate, okay? So what I'd like you to do is step heel to toe and then roll your foot down heel to toe. So it's going to help us practice. Heel, slowly down to toe, heel, toe. And then try to keep your chin, I know you're going to want to look down at your feet. Try to keep your head tall and long, looking in front of you. Heel, toe, heel, toe. Heel toe, okay? And then we're gonna walk the entire length, and then I'm gonna have you turn around and come back, and you're going to walk back as well, okay? Excellent. So go ahead and get started. Heel to toe, good. Heel, toe, beautiful job remembering to look up. Heel, toe, great. Heel, toe, beautiful. And you're staying in a really nice line.
So here are a couple exercises you can do at home. We can do these a couple times a day throughout the day. I'm going to show you a series of 3 or 4 exercises. So just go ahead and show you. The first exercise, these are bilateral heel raises or calf raises, some might call them. So what you're going to do, you're going to find an area in your home that has a counter, preferably waist level, so that you're able to hold on for balance. If you don't need balance or help supporting yourself, then you can do this freestanding as well. But what you're going to do, you're going to stand, feet shoulder width apart, and you're just going to come up on your toes, getting your heels up off the floor, and then you're going to come back down. So you're going to come up off the floor on your toes, and then you're going to come back down. So we're going to do 10 of these, and then we're going to take a rest, and we're going to repeat that for a series of 3 times. Now, like I said, you can do this throughout the day, multiple times a day, but you're going to do a series of 3 sets of 10 in one exercise bout. Another exercise that we can do is a stretch actually for your calf muscles. So what you're going to do is you're going to find a place on the wall. So you're going to face the wall, and you're going to place one foot behind you. And the leg that's behind you, you want to keep that knee as straight as possible. You're going to bend the knee that is in front, like so. Place your hands on the wall, and then you're just going to lean into the wall, keeping your back heel on the ground. That is very important because you won't feel a stretch if that heel is off the floor. So you want to keep your heel down as much as possible. And you're going to bend that front knee, and you're going to bend, moving closer to the wall until you feel a stretch in your calf muscles. And you're going to hold this for 30 seconds. Okay? You're going to relax, come out of it, and then you're going to go back into that stretch. Again, keeping that back leg as straight as possible, holding for 30 seconds, and then you're going to release and come out of it. You're going to do that stretch 3 times, holding for 30 seconds, and again, you're going to do that in one exercise bout. And you can never stretch too much, like Janelle mentioned earlier in our videos. So you can do this, I would say, a minimum of 4 times a day. Another exercise we're going to work on is for balance. So we've done some balance in clinic, but now we're going to have you do these at home. You've progressed to now having your eyes closed and kind of adding in some proprioceptive disruptions into your treatment. So I would like for you to get your feet as close as possible, and you're going to stand and you're going to close your eyes. And we're going to stand here for 30 seconds. Now, if you feel yourself swaying, that's okay. That's actually a good thing because you're being challenged, and the idea is to challenge your balance so that you can get better at it. So we're going to stand here with our eyes closed for 30 seconds. That's 30. And then you can open your eyes. You can spread your feet apart, take a break, a couple seconds, probably 5 seconds to 10 seconds. And then we're going to repeat. So, okay, and then you can come out of that, and then you're going to do that again. So for a total of 3 times for 30 seconds, eyes closed, feet as close together as possible. For this next exercise, we are going to use a TheraBand. This is my pretend TheraBand. And we're going to work on dorsiflexion and eversion of the foot. So you're going to wrap the TheraBand around your foot, like so, keeping it on the ball of your foot, and then you're going to use your left foot to stabilize, like so. And what you're going to do is you're just going to do the dorsiflexion motion, and this is going to provide some resistance to help strengthen the muscles that help you to dorsiflex your foot. Now we're going to do this 20 times before we take a break, and you can do this in long sitting. So to go outward, you're going to just move the foot up like so. Again, this is done with your resistance band. And again, we're going to do 20 of these. And we're going to do these twice a day. All right, everyone, that wraps up today's webinar on ankle sprains. If you guys have any questions, comments, you can reach me at my email and I will supply that at the end. But I hope you are able to take away something from this, and good luck in your treating.